Afternoon. I will be introducing you to the Healthcare Proxy project in the geriatrics practice. You will all be contributing to this project by helping us increase the rate of healthcare proxy documentation. All of you are familiar with advanced directives. I will briefly recapitulate some of the directives that we use in our practice. We use the elaborate MOLST form, Medical Orders for Life-Sustaining Therapy, which detail the patient's preferences regarding resuscitation, artificial hydration and nutrition, and various other preferences. Bear in mind, the patient or the agent on the patient's behalf can make changes to this form at various points in time. The form belongs to the patient and travels with the patient. Our focus for the purposes of this presentation is a healthcare proxy form. Most of you have most likely seen or filled out some of these forms. This is a Department of Health form in the state of New York. It is a form filled out by the patient in the presence of two witnesses, and it lists. The first line mentions the patient's name. Since this form is being filled by the patient, it lists the patient's healthcare agent, someone who can make decisions for the patient at their request in the event that the patient loses capacity. And it is very important to emphasize to patients when you speak with them, this becomes effective only in the event that they lose capacity. Independence is very important to our geriatric patients. There is an optional area for a second agent should the first agent be unable or unwilling to serve. There are other parts to the form which list the duration of validity of the document. This is optional. The document is valid indefinitely if this is not filled out. There is an area regarding the patient's choices regarding healthcare, where they could fill out explicit choices like no feeding tubes, or just write my agent knows my wishes, or even leave it blank. It's optional. The important parts are on the second part of the form, the patient's signature with the date and time. Bear in mind, without a signature and a date and time, this form is not going to be valid. Two witnesses, again with date and time, address, to ensure that the form is valid. There are some other options, including organ donation, which do not necessarily need to be filled out. Some patients do feel anxious when you read out the option, but this is optional. If they don't want to discuss it, you can just dispense with it. I hope each of you will fill out a few forms with us and in the future in your career. Thank you.